Hi there. Something important often gets missed at regular checkups, so let me be honest with you. If you've stopped pleasuring yourself as you've gotten older, your body might be struggling, and you may not even realize it. This isn't gossip or something embarrassing. This is real medical truth. Ignoring this can hurt not just your intimate health, but also your brain, heart, sleep, immune system, and even how you feel about yourself. My name is Dr. Sophia. I'm a urologist and health specialist who's worked with older adults for over 30 years. I've spent my career understanding how our bodies change with age, especially in areas like intimacy, hormones, and staying healthy long-term. One of the biggest quiet problems I see is this. Too many older people stop caring for their intimate health, and that means giving up a major key to their overall well-being. Here's something that might surprise you. Pleasuring yourself isn't just a leftover habit from your younger days. It's actually one of the most powerful tools your aging body still has. It helps balance your hormones, protect your brain, keep your prostate healthy, and even fight off feeling down. And if you've stopped or never really started, the cost to your health might be much higher than you think. In the next few minutes, I'm going to walk you through exactly what happens inside your body when you stop this kind of self-care in older age. What I share might completely change how you see your health and yourself from this moment on. Before we start, if you care about staying sharp, healthy, and independent as you age, please subscribe and turn on the bell so you never miss advice made just for you. If this message speaks to you, type 1 in the comments. If not, type 0. Your thoughts help me create content that truly supports your health and happiness. Now, let's begin with the first, and maybe most overlooked, result of not pleasuring yourself later in life, what it quietly does to your prostate and bladder health. 1. Your prostate and bladder can get weaker. When I first became a urologist over 30 years ago, I didn't expect so many of my patients to share something so private, yet so vital to their health: the quiet disappearance of intimate habits in their later years. One man I remember clearly sat across from me and said, "Doctor, I just thought I didn't need that part of life anymore." He was in his early 70s, fit and sharp, but he'd been waking up 4 or 5 times every night just to use the bathroom, and he couldn't understand why. What he didn't know, and what most people don't realize, is that regular release, even through self-pleasure, plays a big role in keeping your prostate working properly. Your prostate isn't just a quiet gland sitting there. It's a living, active part of you. It makes fluid, it expands and squeezes, and like any part of your body, it suffers when ignored. Without regular stimulation and release, fluid can build up and sit still in the prostate. That stillness creates the perfect place for swelling, soreness, and eventually, pressure that messes up everything from peeing to intimacy. You might feel it as a heavy bladder, a weaker pee stream, or an uncomfortable feeling of fullness that won't go away. These aren't just little annoyances, they are early warning signs. And here's the scary part. Long-term prostate pressure can quietly turn into bigger problems like an enlarged prostate, called BPH, which affects almost half of men over 60. Left alone, it can lead to trouble emptying your bladder, infections, and even needing a tube to help you pee. That same man I mentioned, he eventually needed surgery to relieve the pressure, something that might have been avoided if we'd addressed it earlier with simple, regular habits. Regular release helps flush out the prostate, clear out old fluid, and lowers the risk of buildup. In fact, studies show men who release 21 times or more a month are much less likely to get prostate cancer than those who don't. Let me be very clear. We are not talking about going back to being young or doing this all the time. This isn't about fantasy, it's about function. It's about using your body's own way to protect itself in the simplest, most natural way possible. When you stop this self-care in older age, you're not just ignoring a pleasant feeling. You're risking soreness, swelling, and slowly losing control over one of the most basic things your body does: peeing. I've had patients who became afraid to leave home because they didn't trust their bladder. I've seen strong, proud men worn down by sleepless nights and daytime worry over a problem that might have been managed or prevented with something as simple as regular self-touch. And yes, there's an emotional cost too. Losing control of your body this way, needing to plan bathroom breaks, dreading long trips, waking every 2 hours at night, it eats away at your sense of freedom. It's not just about your prostate, it's about your independence. But here's where it gets even more surprising. What starts in the prostate doesn't stay there. The next result affects not just your body, but your brain. And once it starts, it can change how you think, feel, and remember, sometimes in ways that are hard to fix. Let's talk about what happens to your mental sharpness when self-stimulation disappears from your routine. If you're still listening and this makes sense to you, please type the number 1 in the comments. It lets me know you're here, you're paying attention, and you find this message helpful. Now, let's go to point number 2. 2. Feeling foggy and less sharp. Not long ago, a patient in his late 60s came to see me. He wasn't complaining about his prostate or his energy. He just said something that really stuck with me. "Doctor, I don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my train of thought mid-sentence. I used to be so sharp. Is this just old age?" It's a question I hear more than you'd think. Yes, getting older naturally brings some changes in how we think. But what most people, even smart, health-conscious adults, don't know is that intimate activity, including self-pleasure, plays a strong role in protecting your brain. Here's what happens. When you engage in self-care, your brain releases a mix of special chemicals, dopamine, serotonin, oxytocin, all directly linked to memory, focus, and keeping your feelings steady. These chemicals aren't just about feeling good right then. They help build and protect the connections in your brain. They get blood flowing to your brain. They lower cortisol, the stress hormone that, in high amounts, actually hurts your brain cells. Now, when you stop pleasuring yourself, especially for a long time, those natural brain-protecting chemical boosts happen less often. Over time, this can make your thinking feel dull. You might find it harder to concentrate, harder to understand information, or even harder to feel motivated. It doesn't happen suddenly, it sneaks up slowly. First, you forget names. Then you forget what day it is. Then you might start to doubt your own mind. And in that doubt, something worse can grow: fear. I've seen patients fall into worry and sadness just because they believed their mind was failing, when really, their brain was missing important stimulation and chemical balance. For men, there's an added change. Testosterone, the hormone tied to memory, making decisions, and feeling strong, can drop faster when intimate activity stops. Testosterone isn't just about desire, it's about your sense of self, your strength, your clarity. And yes, regular, healthy release can help keep testosterone levels steadier as you age. Some studies are even starting to link less intimate activity in older adults to early signs of memory loss, even dementia. Now, I'm not saying stopping self-care causes Alzheimer's, but I am saying this. When the brain doesn't get stimulation, emotional release, and hormone support, it becomes more fragile. It loses its rhythm, its toughness. For many people, the fog gets so thick it changes how they live, how they talk to others, how they think, how they see themselves. One man told me he stopped going to his chess club because he couldn't focus on the game. Another, a retired teacher, said he felt blank every morning. These weren't memory problems needing medicine. They were signs of a life disconnected from physical closeness, even with oneself. And here's the sad part. These are avoidable. You don't need costly pills or treatments. Sometimes it starts by reconnecting with your own body, giving it the quiet attention it needs. Because when you wake up your body, you wake up your brain. But losing mental sharpness is just one piece. What happens next, when your feelings start to wobble and your mood dips without warning, can be even sneakier, more damaging, and much harder to talk about. Let's explore how giving up self-intimacy can quietly invite sadness into your everyday life. 3. Feeling more down and emotionally flat. I once had a patient in his early 70s, a widower, retired, fairly healthy. He came to me not for a physical problem, but for something he couldn't quite name. He looked me in the eye and said, "I don't feel anything anymore. Not sad, not happy, just flat." He paused, then added, "Is that normal for someone my age?" That question still sticks with me because I hear versions of it all the time. What many people think is just part of aging, the dullness, the feeling disconnected, the slow fading of strong feelings, often has a deeper physical cause, and one that no one likes to discuss: the loss of intimate touch, especially self-care. Here's the truth: when you stop connecting with your own body in an intimate, physical way, your feelings can start to change in quiet but deep ways. Self-pleasure isn't just a physical act, it's also an emotional release. It's your body's built-in way to ease stress. During release, your brain lets out powerful calming chemicals like oxytocin and endorphins, natural mood helpers that fight worry, tension, and feeling low. When you take that release out of your life, especially during a time when stress, loneliness, or grief are already present, you risk becoming emotionally numb. And that numbness can turn into something more serious: feeling really down. I've seen it happen slowly. Someone stops self-touch after losing a partner, or because they think it's not right for their age. Weeks turn into months. They become quieter, more withdrawn. They lose interest in hobbies, even in talking. They sleep too much or too little. Their appetite changes. Life starts to feel gray. And the cruel part? Most don't see the connection. They blame themselves or think, "This is just how life is now." But in reality, what they're missing is the simple, essential act of connecting with their own body. Not just for pleasure, but for emotional survival. Feeling down in older adults is often missed because it doesn't always look like sadness. Sometimes it looks like tiredness, grumpiness, feeling detached, or just not wanting to do anything. And while medicine and talking to someone can help, I can't tell you how many patients I've helped simply by encouraging them to reclaim gentle physical self-care. One man told me he felt alive again after starting to touch himself regularly for the first time in years. He said it didn't just lift his mood, it reminded him he was still a human being, not just a body waiting to wind down. That small act gave him back a piece of himself he thought was gone. This is what I want you to understand. Self-care in later life isn't about fantasy, strong desire, or shame. It's about keeping your feelings healthy. It's about giving your body a reason to feel, to let go, to remember what it means to be present. Because when you lose that connection, you're not just risking sadness, you're risking loneliness, your feelings fading away, and in some cases, the very will to be part of life. But the emotional results aren't the only ones. As the nights feel longer and your sleep gets more broken, another hidden cost starts to grow, one that can affect your memory, your immune system, and your risk for serious sickness. Let's talk next about how missing out on release might be stealing the deep, healing sleep your body really needs. If you're still watching and finding this helpful, please type the number 1 in the comments to let me know you're here and following along. Now, let's move to point number 4. 4. Worse sleep. I remember a man in his late 60s who came to me after months of bad sleep. He looked worn out, pale, and frustrated. "Doctor," he said, "I fall asleep, but I wake up at 2 a.m. like I've been shot out of a cannon. Then I just lie there staring at the ceiling, waiting for morning." We ran tests. His blood work was fine. No major sleep apnea, no big red flags. But when I gently asked about his intimate life, he looked away. "That part of me," he mumbled, "is over." But that part of him, the part he thought had expired, was possibly the very key to what his body was crying out for: deep, restful, uninterrupted sleep. Sleep isn't just closing your eyes and lying still. It's a complex process guided by hormones. And one of the best natural triggers for deep sleep is something many forget after a certain age: release. During release, your body lets out oxytocin, prolactin, and endorphins, a perfect mix made by nature to switch your nervous system from stress to rest. At the same time, cortisol, the hormone that makes you feel anxious and awake, drops sharply. Your breathing slows, your heart steadies, your muscles relax. You get into the perfect state for deep sleep. Now, imagine cutting that process out of your life completely. Not just once, but for weeks, months, even years. That's what happens when older adults stop self-care. The body loses a natural tool it once used. And what fills the gap? Often, it's restlessness, frustration, tossing and turning. Some turn to sleeping pills. Others just accept being exhausted as their new normal. But the results of poor sleep go way beyond just feeling tired. Long-term lack of good sleep weakens your immune system, speeds up memory loss, raises the risk of heart problems, and makes you more likely to feel anxious or down. In older adults, it also adds to falls, memory troubles, and losing independence. I've seen patients who once lived active, involved lives slowly pull back, not because of a big illness, but simply because they were too exhausted to do anything. And here's what's truly worrying. Many didn't know they were missing the one thing that used to help them sleep. Not a drug, not a vitamin, but their own body's built-in release valve. Self-pleasure might seem like a small, even silly act, but for some, it can be the difference between 4 hours of broken sleep and 7 hours of deep, healing rest. One patient told me after reconnecting with this part of himself, "I sleep like I did 30 years ago. I didn't realize how much I needed that release. I thought I was just getting old." That's the problem. Too many people mistake ignoring their body's needs for aging, and they suffer quietly because of it. If you find yourself lying awake at night, mind racing, muscles tight, hours dragging by, ask yourself, when was the last time your body felt fully relaxed, fully let go? Sometimes the answer isn't a new pill or a breathing app. Sometimes it's about rediscovering an old rhythm your body still remembers, if you let it. But while sleep loss can quietly wear down your energy and thinking, the next result we'll look at is even more physical. It shows up in how your muscles weaken, your balance shifts, and your bladder starts to let you down. Let's talk about what really happens to your core muscles and blood flow when intimacy disappears. 5. Weaker core muscles and poorer blood flow. Several years ago, I treated a retired firefighter in his 70s, a proud, physically strong man most of his life. He came to me complaining of slight pee leaks and trouble standing for long periods without pain in his lower back and hips. "It's strange," he said. "I feel like the base of my body is slowly giving out." What he was describing wasn't just aging. It was the slow, quiet weakening of his pelvic floor muscles. And he wasn't alone. The pelvic floor is a group of muscles at the very bottom of your core, the ones that hold up your bladder, bowels, and private parts. Most people don't think about these muscles until something goes wrong: pee leaks, trouble going to the bathroom, or pain when standing or walking. But here's the part often ignored. Regular intimate touch, including self-care, plays a big role in keeping those muscles active and strong. You see, during arousal and release, the pelvic floor muscles squeeze rhythmically. That squeezing is a workout, not for looks, but for function. It improves blood flow to your lower body, makes the internal support system stronger, and keeps the nerves and muscles talking properly. It's not about performance, it's about keeping things working. When you stop pleasuring yourself regularly, those muscles don't just rest, they start to get weaker. Blood flow slows down, tissues become less stretchy, nerve signals fade, and eventually, you might start having symptoms you never expected. Feeling like you need to pee often, a little dribble after using the bathroom, trouble holding gas, or even pain when moving. For men, this can mean a big drop in intimate function. For women, it can lead to dryness, tightness, and discomfort that makes all closeness feel bad. I've seen once independent people start avoiding going out simply because they didn't trust their bladder. I've seen others get embarrassed about little leaks when they cough or sneeze, not knowing it traced back to something they'd neglected for years: blood flow and muscle work in the pelvic area. And here's something I need to say clearly. Ignoring this area isn't just inconvenient. It can lead to falls, accidents, and a loss of dignity no one deserves. You might start needing pads, special underwear, or planning every trip around bathroom stops, all because the base of your body isn't getting the gentle workout and blood flow it needs. The longer it goes on, the harder it is to fix. What breaks my heart is how many people suffer quietly. They don't talk about it. They feel ashamed, confused, or think it's just part of getting older. But I can't stress this enough. Your body still wants to work well, even at 70, 80, or beyond. And one of the most effective, natural ways to support it, without medicine or gadgets, is through safe, regular self-touch. When you reclaim that connection, you're not just waking up pleasant feelings. You're building strength. You're sending blood where it's needed most. You're waking up nerves, keeping tissues healthy, and reminding your lower body that it still matters. But as physical as this result is, the next one goes even deeper, inside your immune system, your body's defenses, and your ability to fight off sickness. Because what happens inside your bloodstream after release might be one of the most important, yet overlooked, health benefits of all. Let's talk about how missing intimate activity could be quietly weakening your body's shields. 6. Your body's defenses get weaker. A few winters ago, one of my longtime patients, a man in his late 60s who'd always been pretty healthy, came in looking drained. He'd been sick 3 times that season with colds and low-grade infections that hung on. "I used to bounce back in a day or two," he told me. "Now every little bug knocks me out for weeks." When we ruled out the usual suspects, diet, sleep, medicine, I gently asked about another part of his life. "Have you been intimate at all, even alone?" He smiled uncomfortably, then shook his head. "Nah, not for a long time. That part of me is just retired." What he didn't realize, and what most people don't, is that intimate activity, including self-care, has a direct effect on your immune system. That's not a figure of speech, it's biology. During arousal and especially release, your body makes a surge of special chemicals. Not just dopamine and oxytocin that make you feel good, but actual immune-boosting helpers. Immunoglobulin A, IgA, for example, goes up a lot. This is a key fighter that helps defend your body against viruses, bacteria, and infections, especially in your breathing and digestion. Endorphins are also released, reducing swelling and helping healing. Now, imagine going without that boost, not for a week, but for months or years. Your body starts to lose one of its easiest, most natural defenses, at a time in life when your immune system is already slowing down. Taking away this natural helper is like taking the batteries out of your smoke alarm. You might not notice at first, but when trouble hits, your body won't respond like it should. I've seen this happen. Patients who've shut down their intimate lives often find themselves getting sick more often, taking longer to get better, or having flare-ups of long-term soreness. While they might not connect the dots, their body is sending a clear signal. Something's missing. And it's not just about fighting off a cold. Your immune system is tied to long-term health, fighting serious illness, protecting your heart, even healing cuts. Regular release helps keep hormones balanced, lowers stress hormones like cortisol, and increases blood flow, all crucial for a strong immune system. When that disappears, a chain reaction starts. Stress goes up, sleep suffers, soreness increases, and your body becomes a slower, weaker version of what it once was. One woman in her 70s, after losing her husband, told me she hadn't touched herself in nearly 5 years. When we talked honestly about the link between self-touch and immune strength, she decided to try reconnecting with that part of herself again. not for strong desire, but for wellness. Months later, she came back with brighter eyes and more energy. "I can't explain it," she said, "but I just feel more alive, like my body is working with me again, not against me." That's not magic. That's what happens when the body gets the signals it needs. Signals that say, "We're still here, we still want to be strong." It's easy to overlook, dismiss, or feel awkward about, but your immune system doesn't care about embarrassment. It only responds to action. And intimate touch, even alone, is a powerful action. It sends a message of life and strength through every cell in your body. But while weaker defenses might leave you open to sickness, the final result of ignoring self-intimacy might cut even deeper into your very sense of who you are. Because when you stop touching your body, you may slowly stop recognizing yourself. Let's explore how forgetting your own touch can quietly chip away at how much you value yourself and what you can do to get it back. 7. Losing touch with your body and self-worth. I'll never forget a quiet talk I had with a patient in his late 70s. He was a retired school principal, once confident, quick-witted, the kind of man who filled a room. But when he came in for a checkup, something in his posture had changed. Shoulders a little slumped, eyes a bit dimmer. As we talked, he sighed and said, "I don't really feel like I live in this body anymore. I feel like I'm just using it." That sentence stayed with me because what he described isn't rare. I've heard it from men and women in different words, but with the same core truth. Somewhere along the way, they stopped feeling at home in their own skin. And too often, it starts with silence, with giving up self-intimacy, brushing it off as no longer needed, too late in life, or something they've outgrown. But here's what really happens. When you stop touching your body, when you stop paying attention to it in that deeply personal way, you begin to pull away from it, slowly, quietly, and sometimes for good. Self-touch isn't just about feeling good, it's about being present. When you gently stimulate your body, even with no big goal, you remind your whole nervous system that you are still here, that you matter, that your body is still part of who you are, not just a container you're waiting to leave behind. Without that connection, something changes. A kind of emotional and mental distance forms. It becomes easier to ignore little aches, easier to avoid mirrors, easier to believe this part of life isn't worth caring for. And that is the most dangerous loss of all, the loss of your own sense of worth. I've seen this disconnection lead to deep emotional numbness, shame about getting older, pulling back from hugs or closeness, even losing the drive for basic self-care. People stop moving, eating well, dressing nicely. Why bother, they think. This body doesn't feel like me anymore. One woman told me she hadn't touched herself since menopause. "I just stopped feeling like a woman," she said, "and the less I touched myself, the more I disappeared." That word, disappeared, hit hard because that's exactly what happens for many older adults who stop connecting with their physical selves. They don't just lose pleasure, they lose their identity, their visibility, their sense of being truly alive. And here's the part I need you to hear. It doesn't have to be this way. Reclaiming your body through self-touch isn't about being like you were at 20. It's about honoring the life still inside you, right now. It's about saying, "I'm still here, I still feel, I still deserve to be seen, even by myself." When you gently reconnect with your body, even in the privacy of your own home, you start to undo that quiet fading away. You remind yourself that aging isn't vanishing, that your worth didn't run out with your youth. You come home to yourself again, and that perhaps is the most healing act of all. Final thoughts, taking back your health and yourself. Looking back over my years helping older patients, what strikes me most isn't just the medical issues, but the quiet, invisible losses they carry, losses that don't show up on tests. A man who once felt sure of himself now avoids his reflection. A woman who once glowed says she hasn't felt anything in her body for years. And too often they've been told, "That's just aging." But I don't believe that. not for a second. And if you've stayed with me this far, I don't think you do either. Because here's the truth. The moment you stop caring for your intimate self, the moment you ignore that part of your body and spirit, a chain of quiet troubles begins. We've walked through them one by one. How your prostate and bladder can weaken when regular release stops. How your brain can get foggy and less sharp without that gentle wake-up. How missing physical closeness can invite feeling down, ruin sleep, slow your blood flow, and even weaken your body's shields against sickness. And perhaps most painful of all, how forgetting that private, personal connection with your own body can slowly eat away at your sense of worth until you feel like a stranger in your own skin. These aren't small things. They aren't just part of getting old. These are warning signs that your body, mind, and heart are asking for your attention. I've sat with patients who felt broken, disconnected, numb, and I've seen the light return to their eyes when they begin to reclaim this part of their life. It doesn't need anyone else. It doesn't demand youth or perfect health. It only needs your permission. Permission to see yourself as worthy of kindness and touch, even now. Especially now. I know this topic makes some people uncomfortable. Some feel shy. Others were never taught it was okay to care for their intimate health as they age. But I want you to hear this from a doctor who's walked this path with thousands. It is not only okay, it is essential. Gentle self-care in later life isn't about doing too much. It's about blood flow, clear thinking, balanced feelings, strong defenses, and knowing who you are. It's not a luxury, it's a form of self-respect, a way of saying, I am still alive in this body, and I will care for it. One patient once told me, I didn't realize how much I missed feeling like me until I finally touched that part of myself again. That's what this is about. Not just staying alive, but feeling alive. Not just getting through the years, but living them fully with presence, dignity, and quiet joy. So if you've forgotten this part of you, or put it away, or judged it, I invite you now to reconsider, to reconnect, to remember your body is still listening, still able, still worthy. Start small. Start with curiosity. Start with kindness. But most importantly, start. Because in choosing to care for this part of yourself again, you're not just protecting your health. You're taking back your life. If this message felt true for you, please don't keep it to yourself. Like this video, share it with someone who might need to hear it, and leave a comment below to let me know what you think, whether you agree, disagree, or have questions. Your voice matters, and your story might help someone else feel understood.